Exactly, like why surgery? Despite its long working hour, and it's like completely a physically and mentally exhaustive field, and it's I can't say it's can't practice independently, but it's quite difficult to practice independently in the early period of your career. Yeah, these are the hurdles which everyone puts in front of us whenever we discuss. No, guys, I just want to take surgery. These are the hurdles which come in front of us. I will tell you one thing, guys. Like uh, the surgeons or those who want to take surgery usually got a very simple thought process. I just narrate a small story. Whenever I discuss with my medical colleagues, right? So they always have this concept of assuming things and getting treated. I used to talk with my guys from PGA and AIIMS Delhi. So they have this kind of thought process that they assume that this patient is having this problem and I'm going to give this drug. This drug is going to act on this receptor. This ion will get released and the patient will get cured. So when they give the drug, it acts and the patient gets cured, right? They will have this dopamine release here. Wow, what happened when what we saved the patient. But my thought process or the surgeon thought process is very clear cut. We don't want to complicate things like that. So we have very simple thought process like if it is there, it is there. If it's not there, it's not there. That's it, man. If it is there, we want to operate the patient. If you think the patient is an acute abdomen patient and a straightforward, you just open and see. If you don't want to open and see, just do a conservative management. So surgeons or the persons who opt surgery or those who are having a very simple thought process. They don't want to complicate things and they don't want to beat around the bush kind of guys. So if your thought process are like, no, man, I just want to have a simple thought process and lifestyle, you can definitely opt for surgery. And will have clarity in thought process and you don't beat around the bush. Like if it is there, it is there. If it is not, it is not. As simple as that. You live a very simple and clarity life. And yes, guys, there will be a progressive personality in a surgery. So everyone got their own personality when they enter any field, right? But the personality will be very progressive. Progressive means in professional life, in personal life, you will get more ahead in every point of life because continuous learning and progression is incultivated in our residency program. So whether knowingly or unknowingly, you learn this habit of continuous progression. So that will make your personality a progressive personality, guys. And respect plus swag. Being a medico, you will definitely get respect. Right now, the trend is changing. It's a totally different story, but the respect plus swag comes only in surgical field. Whether you take an emergency general surgery or any other field, the surgical field gives you the swag, guys. So these are a few aspects. Still, the guys are girls are taking surgical field mostly because of these few factors which fascinates them. But in this session, we are going to see much more than this, which makes you to take or which you're looking for. So what is the scope of surgery in India and abroad? It's an evolving branch, and we are completely evolved from open to laparoscopic to robotic, and obviously through natural orifice surgeries as well. It's an evergreen and ever evolving branch. No one will question about it. So the arena to choose is very huge, guys. If you enter the surgical field and if you feel this hardcore general surgery is not suiting you, you want to go for something cosmetic, something lighter, you have an option to change. The arena to choose is huge here. So that makes the whole field plausible and flexible. So that's one of the very important thing in surgery you can see. And job opportunities are huge, especially in tier 2 and tier 3 cities more than tier 1. Yes, of course, in tier 1 cities you got a good job opportunities, there's no doubt on that. But due to the super specialty trend and the opportunities for in tier 1 cities are quite competitive when compared to tier 2 and tier 3 cities. We'll completely discuss about this super specialty trend and job opportunities tier 1 in the upcoming slides. Job options definitely you'll get in institutes, you'll have in medical colleges, you have in corporate hospitals, private hospitals, and you have in great companies of Tata and all those companies where you will get in a well qualified job, well paid, and no hectic schedule like we assume in a general surgery period. So the job opportunities are cool and good here in general surgery. You can choose whichever you want according to your need. So there's a small gist about what the scope of surgery is. It's an everlasting branch. In a few slides, the pros and cons of taking surgery. So everyone will tell that it is a mentally exhaustive and physically exhaustive field. It takes time to rearrange your lifestyle. It's a very long learning curve. It totally depends on your mentors. At times, it put pressures because if you're sole breadwinner, especially due to your financials and surgeon stress. So, surgeon stress is nothing but in surgical life, it is very difficult to differentiate your personal and professional life because, like, if I operated a case today, if I come home in the night, so even I'm sleeping, I used to think about I have done this. This will it leak? I have done this kind of anastomosis. Will it be okay or will it leak? So this kind of thought process inevitably goes in the surgeon's mind. Suppose everything goes good for the patients, I'll start thinking about the next day patients. Okay, I'm posted this patient for tomorrow. Will it be uh, eligible? Like, will it be fit for anesthesia? Everything good for the patient. So this kind of small stress will definitely be there for surgeon's life. So that is quite inevitable, which I had in the initial period of my career. So what are the main positives or pros about taking a general surgery? It is philosophically, it's a lifestyle than a profession, guys. Like we discussed earlier, it teaches you live at the moment. As I said earlier, like surgeon stress. The surgeon stress I discussed with my senior and colleagues. I told that, sir, like it's eating my personal space even after completing my residency program. Then he taught me one thing: Satish, surgeons are the person who live at the moment, man. So if you think about this for your whole lifetime, you can't have your own life. So whenever you complete a surgery, doing any surgeries, invest your 100 or 200% in that particular time. You check intraoperatively whatever you want to do. You want to take another suture, take another suture. You want to place a drain, do everything intraoperatively. But you close the abdomen, come out, don't think about it. You just completely forgot it. So just start living at the moment, because this kind of words will encourage me a lot, because then I started assuming this live at the moment, change my thought process and give a clarity about how we can lead our life. Not only in surgery, guys, even in life we have to live at the moment. Because if you are not able to live at the moment, right, you will have more kind of struggles and hurdles, and the mental fatigue happens for you. So this surgical career also teaches you how to live at the moment, because unless you expose to something struggles, you can't learn this just by reading or listening to some kind of motivational talks. So this living at the moment, I learned after going to the surgical field. And financially, it depends on where you work. If primary institute, you're heavily taken care of both academically and your financial growth, and n number of perks are there in primary institute like AIIMS and PGH and bigger. If you're private practice, there's the initial lag phase. So get attached to some fixed income hospital, then explore during your initial period after completing your MS general surgery, guys. The financial after MS general surgery will definitely improve exponentially with your experience. So don't worry about that. Academically, always remember things will be there to learn and to teach. It's a good branch for those who are interested in teaching students. There'll be instant gratification, and it's a more creative and artistic field. And finally, surgeons are born, not made. This is an absurd statement, guys. We are born as a children, grown as an adults, we die as an experienced people. So no one is born as a surgeon and die as a surgeon. So with a constant practice, patience, and perseverance, you can also become a great surgeon one day. So just practice, have a patience, have a perseverance. That will definitely fetch you what